Is your acne treatment actually the cause of your low back pain? That could be the chance. So I want to talk about a case study I have with a patient recently, 17-year-old male who came in presenting with low back pain that they haven't been able to diagnose or treat correctly for about 6 months with x-rays, MRIs, all types of diagnostic testing. The gentleman presented to me with low back pain, and it generally seemed like he had true low back issues at the initial onset of care. After a couple visits, I didn't see him respond in the way that I would expect someone his age to respond with care at Greenwich Wellness. Typically, the youth respond really quickly, and we see a drastic change in their neurological presentation in terms of spasticity, hypertonicity, inflammation. And after a couple adjustments, it just didn't seem right. It seemed more energetic. It seemed like more of a metabolic restriction. Something going on with the metabolism of the body on a cellular level. Usually that involves biochemistry, nutrition, organ issues, right? So what we don't typically think in Western medicine is that an organ can be manifesting a condition elsewhere in the body. Like rashes are typically a liver issue, not a steroid cream deficiency, right? So eczema, psoriasis, dumping all these topicals on it, you're chasing symptoms, you're not getting to the cause of it. Gallbladder inflammation, presenting as scapular pain, and people keep getting massages to try to deal with that. There's a whole host of conditions that the organs refer to the body. In this particular instance, this patient had pain across the lower back area, right in the junction, with a legitimate amount of spasticity. So after a couple of treatments, I didn't see the response the way I hoped to see it. So what I did at that point was pulled the patient aside, did some additional testing on the young man, which I did muscle testing, which is rooted in acupuncture meridians. So I was checking his organ function. And as I'm checking his organ function, he tested really positive for weak liver and weak kidneys, which you wouldn't really see in a 17-year-old unless they had some kind of real toxic behavior going on. And at that point, I said to the young man, "You're showing a real liver weakness and a real kidney weakness here, and something's going on. There's something you're consuming that's really affecting your body's metabolism. And now I think there's an energetic referral of pain to your low back." And at that time, he said to me, "That's interesting because I went on Accutane in January. And since January, my back's been in pain." So if you're not aware, Accutane is a very harsh acne medication that wreaks havoc on the liver. The liver needs to be checked constantly. It's also really tough on the kidneys, right? And usually that's downstream. Anything your liver is really suffering from, at some point your kidneys are gonna lack in that too. And kidneys in Chinese medicine are the energy and strength of your low back. The picture is all coming together, right? This is what Greenwich Wellness does. This is what Dr. Massoud does. This is what the Massoud Method is about. And if you're just chasing symptoms, you're never gonna really get to the cause of it. With that said, after we addressed that issue and I spoke to him and I told him about what the medication does, we then put him on a liver, kidney, and multi-mineral, multi-nutrient support, organic whole food-based supplementation. And about 2 days later, he comes back and his back pain is starting to get better and he's feeling better. His decision was that I've already done it this long. I only have 1 month left. I'd like to continue on and finish the treatment. Okay, well then here's the foods that are going to counteract what this medication is doing to you. Everyone has a choice to do what they want to do. Whatever patients choose, we support them and treat them through the process. It's very important to understand that when you're given a medication, something is going to be taken away, right? To cheat a disimbalance in the body with petrochemicals, which are pharmaceuticals, is going to cause a deficiency somewhere else. I don't know anyone who's really ever been given drugs by a doctor and the doctor said, "This is going to be the side effect, this is what it's going to take from your body, and here's what you should replace it with." That's not really doctoring, in my opinion. Doctor means teacher. I always say that. You didn't learn anything. You just got a pill. Hey, your skin's dried out. We're taking out your melanin production. Your liver's shutting down, but you got less blackheads. I did my job. That's really poor. That's really poor, in my opinion. You got to do better than that. And if any of the doctors applied basic science and basic biochemistry to their treatment protocols, they would understand they're about to send this young man out with a massive liver weakness and a massive kidney deficiency. And why does he need his liver? Who the hell needs one of those anyway? Probably because he's a 17-year-old boy going through hormonal changes, and the liver is responsible for processing the hormonal issues. And if you are having acne, The liver is probably the reason you're having it to begin with, because it's weak. It's not strong enough to metabolize all the hormones that are going through the body. So someone presenting with acne in the first place already had liver weakness. Now you're going to dump a chemical in there to make the liver even weaker, and then you're not going to give anything to support the strength of the liver throughout this process. This is horrible medicine. This is the sick care system that I'm constantly talking about in the videos, and it's embarrassing. I'd be embarrassed as the treating physician if that was my treatment protocol, and then I sent this kid into a whole 6-month struggle with low back pain, and that no one can identify, at least no one practicing shitty medicine, because that's what that is. Not to say there's never a time or place for drugs or pharmaceuticals or medicine, but understand that you're not fixing anything in that aspect. And there are natural ways to clear your skin. And it would have been like largely liver and hormonal support for the young man who now went on to a product that is so toxic, he probably can't even process hormones. Yeah, it's zapping away everything under his skin, but in the meantime, he's developing some deeper underlying issues, metabolic issues, that will eventually lead to digestive issues and immune issues downstream, because there's really no metabolic process your liver isn't involved with in the first place. So that's a long way to get to a point where I wanted to explain that everything that you feel in your back isn't really coming from your back. Prostate, inflamed prostates refers low back pain. A good chiropractor is going to be able to look at you and understand if your back pain is truly coming from your back or if it's coming elsewhere. The fact that I practice Chinese medicine and have a history in nutrition and all these other things gives me a more well-rounded approach in seeing that. But you don't necessarily have to have all the things that I have to know this and to see this. Basically, if you're the prescribing doctor, you just have to know what the drug does to the person before you give it to them. That's like the bare minimum, right? They don't have to be able to figure out everything that's wrong, but you should at least know what can go wrong when you're giving this patient the medication. As a chiropractor, it would have been justified for me to treat this young man for 3 months without any question at all, because that's pretty much a treatment protocol for most people. 3 months, see if he get better, and see, hey, if he's not better, then we'll order additional testing, because the testing is always the answer, never the treatment. So we didn't do that. I don't do that. It didn't present right. It didn't look right to me. Young people should heal fast, and if they're carrying something that long, there's something deeper going on. That's what I do at Greenwich Wellness. Greenwich Wellness gets you better quicker because we don't chase pain. So be mindful of what's being given to you. I would suggest that anytime any doctor hands you any medication, you ask them, what is it? What are the side effects? And what nutrients is this going to rob from my body? Because you're going to end up nutrient deficient with long-term prescription drug use. That's just a fact. And what should I do to undo these consequences of the medication that it's putting me on? And the other question I really love is, how is this medication actually treating me and making me better? And I would love to hear the answer to that one. If you guys could come up with it, let me know how Accutane actually heals you and makes you better, as opposed to bombing everything in your body and just letting it all die. All right, so that's my soapbox for now. I'll probably be back with more stuff that you should or shouldn't do in the near future. Be well, guys. Thank you.